Welcome back. My name is Jafet Kamala, and we are going to view a tutorial on how to register a client using AfyaCare. Sorry, I just went without explaining. We have already opened my Google Chrome web browser, and also I have entered my IP address, or you can enter your URL depending on the setup of your facility. Then you will end up on the main page where you have a clinical service button and laboratory button. My side, I'm going on the clinical service button. I will end up on the page, on the login page, where I'm supposed to insert my username and the password. And also I need to select a location or position where I am. If it's OPD, it's a registration. You might be at CTC or wherever, but I'm at OPD. That's my office or my registration point. And then I will click login. But before I go to login, there is a warning here saying that the server time zone, wherever, but this doesn't affect our data, so it will be rectified later on. So I will click login, and then I will end up on the page where I have a registration button, diagnostic patient, and mortuary. Remember, these are just privileges. That's why I am able to see the registration button, diagnosis, and the mortuary. If a system admin removes the privilege for me to view diagnosis or mortuary, I won't be able to see them. For our case, we are going to register a client, so I will click registration. Now I'm at the registration page. If I have a new client, I will click register new client. If it's already existing client, the client who is already registered in my system previously, it means I will click register new client. If it's already registered, I will type the patient ID inside there, and then I will click search, or I will type the name or file number on national identifier or registration number, then I will click search. But for our case, for now, let's click register new patient. That's how I've registered, and as you can see, we have some information. The red highlighted with asterisk, you can see it's red. It means more important information. We can't miss them. We have a place where you can take an image, but for me, I have disabled it now, so I want to be able to take an image. But if it is allowed, depending on Tanzanian health policy, you can take a photo of a patient. You can take a photo for your patient. If it's now we are registering client, if it's an emergency case, I will tick this box, and the system will give me few information that's supposed to be registered. The information which is entered here are based on the guideline of Ministry of Health. So the one who is using the system, registering a client, knows what to do here. But my patient is not an emergency one, so I'm just going to remove that tick. And then I'll go to the next line. Patient ID. This is automatically entered. The system generates this ID automatic for the first time when the client comes to the hospital. But previously, before using the system, it means patient were using a certain ID formulated at the facility. It means I will tick the enter ID button. This will give me another room for me to enter any ID which is already available for a particular patient. But for our case, our patient is totally new, so I don't have any ID. So I will remove this tick. And also we have a patient name. So here I'm going to write a patient name. My patient is Mwana Chausiku Bundi. This is the name of my client. Sex is a female. Then I have an age button where we set the age, if they have know the month, if I know the days. When I will set the age, the below date of birth will feed itself out automatically. For example, if I put that my client has 60 years, beneath the system will say this patient was born on 1st of July, this the 1960. The 1st of July, this is the default for anyone who doesn't know when the exact date and month when he was born. But in case the patient knows the date and the month, instead of me feeding this age on button here, I will write, I will insert the age below, date of birth, I will insert month, and also I will insert the year. Automatically the system will insert the years, months, and days. Also, if it's an estimate, I will click estimated button. If it's a baby, I will insert the time the baby was born, but for this age, this is not a baby, this is a grown-up lady, so I will insert the birth time. I will set also the number, the patient number. I will set the tribe. If the patient is a non-Tanzanian, it means I will write others. If you write it, it will populate the information beneath. Then you select. If it's Tanzanian, maybe a higher, I will write higher. And then you see the higher will populate, and then I will select. If it's a Chaga, I will write Chaga. It will populate, and then I will select. If it's a Sukuma, I will write Sukuma. The system will populate, and then I will select. And then referred from. If the patient came to my facility being referred from another facility, I will select where the patient is coming from. Okay. After that, I will set the village where the patient is coming. Maybe my patient is coming from Majengo. Now, if you see, if I start writing Majengo, you see if there is another Majengo in another district and councils, they will populate. So it will be my task to look which is the exact Majengo I want. Mine, I want Majengo in Lindi. So if I click Lindi, you see district village is Majengo, district is Majengo, council Lindi DC, and region will be Lindi. That's how it is inserted. Also, like I've already spoke with my patient. Now I think I want to send the patient to the doctor. I will select and choose a doctor. So you know you have a doctor's room. We have diabetics. We have a patient therapy, etc. So I will send my doctor to doctor room 2. Now remember, if I send a doctor to room 1, the doctor in room 2 won't be able to see that client. The client will be seen by a doctor in a specific room. So the registrar must be sure, and where he's sending the patient, make sure that there is a doctor in that room. So for my case, I would send my patient in room number 2. Also, we have additional information. If needed, we can insert them. Additional patient information. If you click on the row, it will expand, and then you insert the information: education details, marital status, place of birth, telephone number, if it's a new patient, yes or no, occupation, file number, etc. This information are needed especially in vertical programs like TB, CTC, and RCH. Also, we have a national identification whereby I can type in the ID, the registration vote, the passport ID, a driving license. Once I select any, it becomes a mandatory for me to finish the whole information. So I won't do it for now. Next of kin, also you can expand it and insert the name, relationship type, next of kin contract number, and if there is another issue that I specify. Relationship, if I click, I can select a relationship. I select this as sibling, parent, supervisor, and then I will be forced to enter the name or the ID of a patient. So, but this is from the additional patient information, national identification, next of kin, and relationship is not mandatory. The mandatory one are these above as you can see. Then, after making sure that I have collected all the information that is needed, I will start the visit. And if you start the visit, you will end up, the registrar will end up on the page where he is supposed to enter other information. So at the facility, we have Start OPD visit, and also we have Start CTC as a vertical program, Start VCT as a vertical program, and also Start TB as a vertical program. This is the setup of my facility. This Start visit, it depends on the facility where you are at the moment. So for my part, I will click Start OPD visit. I will click Start OPD visit, and I will end on another page where I'm supposed to enter the payment information. Also I can print other stuff. Thank you for listening. Now we will see another. There is another clip which will explain